Welcome back to the Deep Dive, everyone. Today we're tackling something you deal with every single day in your practice: veterinary diagnosis. We've got 100 top consultations in small animal general practice as our guide. And trust me, this book is packed with practical tips that go way beyond textbook basics.
It's all about making those crucial decisions within the reality of a 15-minute consultation. We'll be looking at how seasoned vets make it look so smooth, without making the client feel like they're being rushed out the door.
Okay, so the book breaks down diagnosis and treatment into 6 steps: history, examination, nailing down those diagnoses, tests, prognosis, and finally, the treatment plan. But let's be honest, fitting all that into a short appointment can feel like a juggling act. What are some of the secrets to making it work?
Well, it starts with mastering the art of history taking. It's more than just passive listening. It's about actively guiding the conversation, knowing when to listen intently and when to interject those targeted questions that get to the heart of the matter.
It's almost like being bilingual.
Right.
You've got to translate complex medical jargon into everyday language that clients can actually understand. And sometimes you're reading between the lines, picking up on those subtle cues or hesitations that reveal more than the client might even realize they're sharing.
Absolutely. It's a bit like being a detective, for instance. The book mentions how crucial it can be to pay attention to other people in the room, too. A partner or child might casually mention something that completely changes your understanding of the situation.
You never know where that key piece of the puzzle might come from. But after gathering the history, it's time for the physical exam. Now, I've always been taught that a complete physical exam is standard procedure. But this book actually challenges that notion, doesn't it?
It does. 100 Top Consultations debunks the myth that every case requires a full head-to-tail exam. There are times when a focused exam, zeroing in on the area of concern, is enough. If a dog comes in with a limp, you'll naturally concentrate on the affected leg. But if the symptoms are vague or point to a systemic issue, then a complete exam is absolutely essential.
It's about using your judgment and experience to tailor the exam to the situation. Now, I find it fascinating how the book describes 3 distinct paths to reaching a diagnosis. There's that aha moment of pattern recognition, which I imagine comes with years of practice.
Yes, that's the intuition that develops over time. But there's also the approach of making a tentative diagnosis based on probability. You're choosing the most likely option. But with the awareness that you might need to reassess if things don't improve as expected, it reminds us that diagnosis is an ongoing process.
It's like starting with a working theory, but always being prepared to revise it. And then there's the problem-oriented approach, which seems particularly valuable when dealing with complex or unclear cases.
Exactly. You create a list of possible diagnoses, those differentials, and then use targeted tests and investigations to narrow it down. The book really emphasizes the danger of falling into the trap of a standard workup. It's about being strategic and choosing tests that specifically address those differentials.
Don't just order every test under the sun and hope something sticks out. But even when tests are necessary, there's a cautionary note in the book about not simply transferring the responsibility of diagnosis to the lab.
That's so important. Test results are just one piece of the puzzle, and it's dangerous to blindly rely on them without considering the bigger picture. We have to correlate those results with the history, physical exam findings, and our own clinical judgment. Otherwise, you risk falling into some dangerous traps.
Like relying too heavily on normal ranges, which are just statistical averages and don't always tell the whole story. Or misinterpreting results without understanding sensitivity and specificity. Can you give us an example of that?
Sure. Imagine you're using a test with high specificity but lower sensitivity to check for a particular parasite. A negative result would strongly suggest the absence of the parasite, giving you confidence to rule it out. However, a positive result might not be as definitive because of the lower sensitivity. It highlights the need for follow-up testing or considering other clinical signs.
So, it's not just about ordering tests, it's about understanding their nuances and limitations.
Right.
Of course. The quality of the sample itself can have a huge impact on the accuracy of the results.
Right, absolutely. A poorly collected sample can throw everything off, leading to misleading results and potentially incorrect diagnoses.
Speaking of potentially difficult situations, let's talk about prognosis. Once you've arrived at a diagnosis, that's the next hurdle. And this is where things can get a bit more delicate, wouldn't you say?
Definitely. In veterinary medicine, prognosis is a more crucial conversation than in human medicine. It's not just about medical possibilities, it's about balancing those with the animal's well-being, the owner's wishes, and their resources. You're helping them make difficult decisions, sometimes about whether continuing treatment is the kindest option.
It's about honest, open communication. And sometimes those conversations are about preparing owners for the possibility of saying goodbye.
Exactly. You have to be prepared to guide them through all the possible outcomes, from the most optimistic to the most difficult scenarios.
Now, let's move on to treatment. And as the book emphasizes, this goes beyond simply writing prescriptions. It's about creating a plan that addresses the animal's specific needs, takes the owner's lifestyle into account, and utilizes both specific and symptomatic treatments as necessary.
Right. Ideally, you're targeting the underlying cause whenever possible. But for chronic conditions, symptomatic management becomes key. The book also reminds us that while evidence-based medicine is essential, there are times when clinical experience plays a vital role, especially when the research on a particular condition is limited.
And speaking of outdated practices, I was intrigued by the book's take on the automatic injection. That old school notion that every visit requires an injection, even if it's not medically necessary. Why is that practice falling out of favor?
It's not evidence-based. It can be stressful for the animal, and it perpetuates the misconception that injections are always superior to oral medications. We need to select the most appropriate route of administration based on the medication and the individual patient.
And of course, compliance is crucial. A perfectly designed treatment plan is worthless if the owner can't or won't administer it correctly.
Absolutely. That's why tailoring the plan to the client's lifestyle and providing crystal clear instructions are essential. You want to empower owners to be active participants in their pet's care.
Which brings us to the importance of rechecks, which are so much more than just a quick "how are you doing" visit. They should have a specific purpose, and that purpose should be clearly communicated to the owner.
Right.
Yeah.
Absolutely. Whether you're monitoring progress, adjusting the treatment, or addressing new concerns, that purpose needs to be front and center and clear. Consistent record keeping is vital, especially when different clinicians might be seeing the animal for recheck.
You want to ensure everyone is on the same page and that the treatment plan remains consistent. It's about providing seamless care, even with multiple clinicians involved. Now, before we wrap up this part of our deep dive, let's shift gears to hospitalized patients and the SOAP system.
Yes. SOAP. Subjective, objective, assessment, plan. It's a systematic approach to monitoring in patients, ensuring consistent and thorough care, even with a rotating cast of staff members.
Can you walk us through how that system works in practice? I'm sure our listeners would appreciate a real-world example.
Of course. Imagine you're checking on a hospitalized dog. You start with the S, the subjective observations. Is the dog brighter, more alert, eating better? These are things you can't measure but are vital clues. Then you move on to the O, the objective data. That's where you record the measurable parameters: temperature, heart rate, respiratory rate, any changes in lab work.
So you're essentially gathering both a qualitative and quantitative assessment of how the patient is responding to treatment.
Exactly. And that leads you to A, the assessment. You analyze the subjective and objective findings, form an overall picture of how the patient is doing, and determine if they're stable, improving, or declining.
And based on that assessment, you create the P, the plan. Adjust medications, order additional tests, consult with a specialist if needed. It's such a logical framework for ensuring nothing slips through the cracks.
It is. And that same systematic approach applies whether we're talking about inpatients or those trickier cases that just aren't responding as expected. The book emphasizes that when treatment fails, it's time to step back and reevaluate everything.
In your experience, what are some of the most common reasons why a treatment might not be working?
Sometimes it's simply that the initial diagnosis was inaccurate. We might have missed a subtle clinical sign or misinterpreted a test result, or perhaps there's an underlying condition complicating the picture that wasn't apparent at first.
So it's back to basics. Revisiting the history, re-examining the patient, and potentially considering new differentials. And of course, keeping the owner informed and involved every step of the way is paramount.
Absolutely. Especially when things aren't going as planned. Maintaining open and honest communication is crucial for building trust and ensuring the client feels supported. And that brings us to another point. The book highlights consistency in patient care, especially when multiple clinicians are involved.
Because you don't want the owner to feel like they're getting conflicting advice, or that the treatment plan keeps changing with every vet they see.
Exactly. Thorough and consistent record keeping is the key. That first clinician needs to document everything clearly. The history, the rationale for the diagnosis, and the details of the treatment plan.
It's like a relay race. You're passing the baton to the next clinician, and you want that handoff to be seamless.
Perfect analogy. Everyone on the team needs to be on the same page, working together to provide consistent and coordinated care. Now let's revisit something we touched on earlier, pattern recognition. That ability to see a familiar set of symptoms and instantly know what's going on.
It sounds almost magical, like a sixth sense that develops with experience.
It does feel that way sometimes, especially after you've seen countless cases and those patterns become ingrained. But the book offers some practical advice for honing those pattern recognition skills, even for those of us who aren't seasoned veterans yet.
I'm all ears. What's the secret?
It's about actively seeking out diverse experiences, shadowing experienced clinicians, attending conferences, maybe even rotating through different specialties. It's all about expanding your knowledge base and building that mental library of clinical patterns.
So it's not just about seeing a lot of cases, it's about seeing a wide variety of cases.
Exactly. And the book emphasizes the importance of paying attention to the details. It's not just about focusing on the obvious, it's about observing the animal's behavior posture, those subtle cues that can often hold the key to unlocking the diagnosis.
It's like being a detective noticing those tiny inconsistencies that others might overlook. But as valuable as pattern recognition is, the book cautions against becoming overly reliant on it. Why is that?
Because even experienced clinicians can fall into the trap of confirmation bias. We see what we expect to see, and sometimes that can blind us to other possibilities.
It's that human tendency to seek out information that confirms our existing beliefs, even when the evidence might be pointing in a different direction.
Exactly. And that's why it's so important to always maintain a healthy dose of skepticism, to be willing to question our assumptions and consider alternative diagnoses.
So critical thinking is just as important as experience when it comes to accurate diagnosis.
Absolutely. And that includes staying up to date with the latest research and advances in veterinary medicine.
Because what we know today might be outdated tomorrow.
Exactly. Veterinary medicine is a constantly evolving field. New discoveries, new diagnostic tools, new treatment options. It's an exciting field to be a part of, but it also demands a commitment to lifelong learning.
It's not enough to just rely on what we learned in vet school. We need to actively seek out new information, attend conferences, read journals, engage in continuing education. It's about embracing that intellectual curiosity.
Absolutely. It's that dedication to continuous improvement that ultimately benefits our patients. Because the more we know, the better equipped we are to provide them with the highest quality care.
Well said. And I think that's a perfect note to end on. Now, this deep dive has been incredibly insightful. We've covered so much ground, from the nitty-gritty details of history taking and physical exams to the broader concepts of critical thinking, communication, and collaboration.
It's been a fantastic journey through the ardent science of veterinary diagnosis, those crucial steps that allow us to make confident decisions and provide the best possible care for our patients.
And for all of you listening out there, whether you're a seasoned veteran or just starting out on this incredible journey, remember that the pursuit of knowledge and the commitment to excellence are what make this profession so rewarding.
It's about that passion for learning, that dedication to our patients, and that unwavering drive to always do better.
That's the heart of it all, isn't it? Thanks for joining us on this deep dive, and until next time, keep those brains engaged and those hearts passionate.
We'll see you next time.